As a good clinician, one must be able to take detailed history and examination and at least start to form its differentials. You should not be diagnosing as a single disease, but you should be able to form certain differentials over the of every disease as well. What other possibilities could be the patient having as well? For example, if the patient comes to you and presents with anterior knee pain of intermittent origin, dull aching pain aggravated by activity, yes, patellofemoral pain syndrome, it could be a possibility, but what other differentials which should come into your mind as well? And when we are discussing about the knee pain, there are certain very specific disorders which may present with the knee pain as well. For example, patient may be having a problem of it may not be the knee which is problematic, it's rather the problem will be lying in the hip, and patient may present with the rapid pain or radiating pain towards the knee joint. As you know, the patellofemoral pain syndrome also occurs in the adolescent age group, and if the patient is, let's say, 13, 14 or 15 years of age and a boy and is actually present with the knee pain, the first and foremost thing you should be also thinking is that this could be capital femoral epiphysis as well. Very classical presentation of SCAFE is usually that patient boys usually come of this age, 13, 14, 15 years of age. They have a knee pain. Usually they get, doctors get an x-ray of the knee. X-ray of the knee is absolutely normal. Pain curve is given and they go back and they represent with the knee pain as well, because the problem is not in the knee but higher up in the hip. So whenever patient with patellofemoral pain syndrome comes in, you need to make it sure that it's purely the knee pathology. It's not actually the referred pain from the hip of for example, it's not slipped capital femoral epiphysis, which is actually resulting in knee pain. It could be the patellofemoral disorders. Now, patellofemoral disorders could be other patellofemoral problems such as patellar instability, which could be due to either the medial patellofemoral ligament injury, or it could be the quadriceps weakening, vastus medialis obliquus weakening, or there could be increased irritable band tension leading to lateral dislocation or displacement of the patella. There could be patellofemoral overload due to mechanical instability or even the mechanical malalignment. This could be overload leading to overuse injury, eventually leading to increased anterior knee pain. Other could be causes osteochondral injury. This could be that there may be the underlying problem may be chondromalacia of the patella, and this may be presenting with anterior knee pain or patellofemoral osteoarthritis. This could be underlying post-traumatic patellofemoral arthritis or post-surgical or iatrogenic injury in which there may be associated with patellar malcracking. Whenever you take detailed history and examination, you need to rule out these differentials. The problem is in the hip, patellofemoral joint, and if it's in patellofemoral joint, could this be instability, overload, osteochondral injury, or could this be osteoarthritis as well? Or this could be knee joint. As we are having a knee joint pain, the problem could be the knee joint as well. This could be due to osteochondral desicans. This is actually a problem of the knee in which there's actually cartilaginous lesions which develop and may be causing the pain. Or this could be loose bodies in the joint. Or this could be synovial chondromatosis as well, in which this cartilaginous lesion actually in the synovium, and they may present with multiple loose bodies in the knee joint. Or there could be plica syndrome, in which this is a rare disease in which there's actually thickening of the plica, and this may present with anterior knee pain due to thick synovial tissue, and this may be resulting in thick cartilaginous tissue as well. And patient can present with pain, anterior knee pain, and which may mimic sometimes meniscal injury as well. Other is periarticular disorders, which includes patellar tendinitis. For example, patient may not be having a problem with the patella or undersurface of the patella, but it simply would be the patellar tendon, which may be bruised, which may have teared up due to any activity, may have some form of a micro tear which may be present in the patellar tendon, which may be causing the pain. It could be patellar ligamentous strain or sprain of the patellar tendon, or it could be even simply bursitis. For example, there could be patient maybe somebody who is actually, for example, if patient is a clergyman, they may be kneeling down over the knees for their pairs, and this may result in increased bursitis over the anterior knee joint, and this may result in anterior knee pain. Or there could be patient could be a housemaid doing work, for example, by kneeling down, and this could have resulted in this sort of a problem. Or it could be, if patient is a child, this could present with Osgood-Schlatter disease, which is actually tibio-tubercle apophysitis, which also presents with similar kind of a situation. There is anterior knee pain, which may be dull, aching, and increase with activity, but the problem is not in the knee at the patella, but lying down there in the tibio-tubercle. So whenever a patient with anterior knee pain presents to you, you must keep all these differentials in your mind. For example, patient may be having a problem in the hip joint. This may be leading to a rapid pain towards the knee joint, like it could be patient may be having underlying SCAPI or LCPD, or it could be patellofemoral disorders, patellofemoral disorders may mimic the problems of the knee joint pain as well, like patellar instability, patellofemoral overload, osteochondral injury, or it could be simply osteoarthritis or patellofemoral osteoarthritis as well. Other than this problem could be in the knee itself as well, like patient may be having osteochondral dissecans, loose bodies, synovial chondromatosis, or even the Placa syndrome as well. And if this not in these three, this could be related to periarticular causes. For example, the patellofemoral joint and knee joint may be normal, but outside or around the patella, there could be other things like patellar tendonitis, bursitis, patellofemoral ligament strain, or even the Osgood-Schlatter disease may present with anterior knee pain as well.